Good morning to all of you. I am presenting this virtual conference on the title Automatic Detection of Leukemia from Blood Cells Using Soft Computing Methods. The reason I am doing virtual conference is I am abroad and I couldn't attend physically your conference. So that's the title. And my introduction, I am my bachelor's in engineering, electronics and communication, master's of engineering in applied electronics and instrumentation, and PhD in digital image processing and computing. And I am having 25 years of teaching experience, which includes 10 years in India in a higher educational institution in a Cornea University, and 3 years in Caledonian College of Engineering, Muscat, and now 12 years in International Maritime College. So they have around a tune of around 14 publications. The objectives of the research are to pre-process the blood cells. Pre-process the blood cells after proper image acquisition using denoising filters and edge detectors. Then to segment leukocytes and erythrocytes from the blood cells. Then segment the leukocytes. Then subsequently detect leukemia using the morphological features of the leukocytes, because we understand that from the lymphocyte we can detect white blood cancer or leukemia. It's a cruel disease. We have an institute in India called Adayar Institute, where they decide the death date of patients. So so that research is really appealing to do some contribution for the detection world, to the oncologists, to help and support the physicians and oncologists as a diagnostic reference for further treatment. So I'll be very quick. Blood cells has three things. One is red blood cells, white blood cells, and platelets. So our job is to first clean the image, condition the image so that we can separate white blood cells from red blood cells, because red blood cells are commonly with the malarial parasites and white blood cells are normally associated with leukemia. Leukemia can't be found in, will never be found in red blood cells. So our first purpose is to separate white blood cells. So these are some of the functional blocks. The first cell is image blood cell acquisition. The second step is pre-processing using denoising filters and edge detectors. The third one is separation or segmentation of leukocytes. The fourth one is classification of leukocytes, and then detection of leukemia, like hematological disorders, from the detected or segmented leukocytes or white blood cells. How do we detect? So first let me introduce you the pre-processing techniques. I have applied so many conventional filters like median filters and Laplacian filters and found that Gaussian filter gives me the best result. So I have shown the image, you can have a look at it. Gaussian image after adding salt and pepper noise gives us the best result. And then here I am giving you the comparison of other filters. You can see from the peak signal to noise ratio, again Gaussian filters performs the better. So we conclude that for blood cell pre-processing, Gaussian filter is recommended. Similarly, in the edge operator, there are so many edge operators. Especially I compared Sobel and Canny edge operators for this purpose, and I found that Sobel edge operator gives us smoothened edges, sharper edges than other operators. And the third step is to segment the white blood cell. There are so many techniques, computing techniques like morphological technique, fuzzy logic, and fuzzy cellular neural network. I have adapted fuzzy cellular neural network, a computing technique to separate the leukocyte or white blood cells. You can see the result. We first convert RGB into hue, saturation, and intensity pattern. Then apply the threshold to get the algorithm. The computing algorithm performed well with the very best segmentation accuracy and with less computation speed, and you can see that as it is given. These are the cells, and this is the segmented leukocyte and the color image restored. So upon comparison with the other techniques, I have compared with the three techniques. We found from the P/SNR ratio, we found that fuzzy cellular neural network gives me the best result. And then the last step is how to separate lymphoblast and lymphocyte. Lymphocyte is a normal blood cell without leukemia feature, but lymphocyte is normal cell. What is lymphocyte? The cytoplasm nucleus ratio will be low. This is the picture we feed into our inference engine, into the computing algorithm to find out whether the given cell is lymphoblast or lymphocyte. So whereas for lymphoblast, the cytoplasm nucleus ratio will be very high. Similarly, cell size will be high, nucleus size will be high in lymphoblast, leukemia blasted image. Whereas nuclear perimeter will be very smooth for a normal cell, the nucleus perimeter will be very rough in lymphoblast. These are the features we extracted from the cells we received from oncologists and some leukemia patients, and we have developed the algorithm. Let us say amount of cytoplasm. For normal cell, the cytoplasm will be abundant. For a candy cell, it will be very less. Similarly, I can say cytoplasm color will be light sky blue, dark blue. For a cancer image, it will be dark blue. These are more than enough to feed into our automated algorithm to predict whether the given cell is lymphoblast or lymphocyte. Now, classification of leukocytes. So that you can easily do because the lobes that is available in white blood cells. For neutrophils has 5, eosinophils has 2, and basophils have 3. Similarly, detection of leukemia, we are able to detect 3 levels of leukemia. First one is level 1, blasts are moderately large, moderate blasts are very small. L2, blasts are large and heterogeneous. Whereas L3, we classify the 3rd degree of blast, where the blasts are homogeneous. And then in L3, the vacuoles will be very less. And similarly, in the L1, L2, L3 will be differentiated by the number of vacuoles present in the image. That is another interesting feature which will help us to classify the leukemia. And this is the pattern. I would like to present within 10 minutes, so I would like to run fast and I will show you the F-LAN image. There are 3 algorithms we have used. One is functional LAN, and another one is KAR-FCM. Fuzzy C means clustering. Fuzzy C means algorithm. So another one is KAR-FCM, that is kernel-induced rough FCM. Fuzzy C means algorithm. And we have computed the segmentation accuracy, and we have computed the error rate, from which we deduce that kernel-induced rough Fuzzy C means algorithm is the best. And these are the steps used. I don't have time to explain these steps.